Imagine walking into a doctor's office in the United States sometime around the early 1950s. The room smells faintly of disinfectant and tobacco. A wooden desk sits in the corner beside a tall metal filing cabinet. On the wall hangs a framed medical diploma and a poster about respiratory health. Your doctor greets you, sits down across the desk, listens carefully to your symptoms, and then casually reaches for a cigarette. He lights it slowly, takes a calm drag, and continues speaking. To a modern audience, this image feels almost absurd. Today, we associate cigarettes with warning labels, public health campaigns, and images of diseased lungs. But there was a time when the opposite was true. A time when smoking wasn't considered dangerous. A time when cigarettes were not just accepted by the medical community, they were openly promoted by it, and not quietly. In the 1940s and 1950 seconds, cigarette advertisements across the United States featured doctors in white coats smiling confidently beside brand names. These ads didn't suggest smoking might be harmless. They claimed something much stronger. They claimed doctors preferred certain cigarettes. One famous campaign declared, "More doctors smoke Camels than any other cigarette." The message was simple and powerful. If the people trained to protect health were smoking and even recommending specific brands, then cigarettes couldn't possibly be that bad. Millions of Americans believed it. They trusted their doctors. They trusted medical authority. And the tobacco industry understood that trust better than anyone. So they built entire advertising campaigns around it. But here is the uncomfortable part of this story. By the time many of these ads were appearing in magazines and newspapers, scientists had already begun noticing something troubling. Hospitals were reporting a rise in lung cancer cases. Researchers studying long-term smoking habits were seeing patterns that could not easily be ignored. Something was wrong. Yet at the exact same time those warnings were beginning to appear, another image was spreading across America, the image of the smoking doctor. Calm, professional, reassuring. A symbol of authority holding a cigarette between his fingers. It wasn't an accident. It was one of the most effective marketing strategies in modern history. And it helped shape how an entire generation understood smoking, health, and trust. To understand how cigarettes became linked to medical authority, you have to understand something about advertising in the early 20th century. At the time, public trust in doctors was almost absolute. Physicians were seen not only as healers, but as symbols of scientific progress. The white coat carried weight. A medical opinion could shape how millions of people viewed a product, and the tobacco industry saw an opportunity. By the 1930s, cigarette companies were already competing fiercely for market dominance in the United States. Every brand wanted to appear smoother, safer, more refined than its competitors. But there was one endorsement more powerful than any celebrity, athlete, or movie star: a doctor. If a physician recommended your cigarette, it didn't just look popular, it looked legitimate. And so the companies began quietly integrating doctors into their advertising campaigns. At first, the references were subtle. Ads would mention that cigarettes were gentle on the throat, less irritating. But as competition intensified, the claims became much bolder. Some advertisements suggested cigarettes could actually help with throat discomfort. Others implied that smoking could calm nerves or improve focus during long work hours. Soon the imagery became unmistakable. Doctors appeared in white coats holding cigarette packs. Some were shown examining patients while smoking. Others were depicted relaxing in hospital lounges with a cigarette between their fingers. To modern eyes, the images feel surreal, but at the time they were persuasive, because the message wasn't really about cigarettes. It was about trust, and the tobacco companies understood something fundamental about human psychology. People trust authority figures, especially when the message appears scientific. So they began building campaigns that looked less like advertisements and more like medical advice. Some companies claimed that their cigarettes had been tested by physicians. Others suggested that doctors preferred their brand after clinical evaluations. These phrases sounded technical and reassuring, even if the studies behind them were vague or poorly defined. And for the average consumer reading a magazine in 1945, the distinction between marketing and science was almost invisible. A smiling physician in a white coat could carry more persuasive power than an entire page of statistics, which meant that the tobacco industry had found something extremely valuable. Not just a product to sell, but a symbol of authority to sell it. And once that symbol entered the picture, the campaign grew far more ambitious, because the next step was not simply showing doctors in advertisements. The next step was claiming that doctors themselves preferred a specific cigarette. In 1946, one of the most famous advertising campaigns in American history began to appear across magazines, newspapers, and billboards. The message was bold, clear, and extremely effective. More Doctors Smoke Camels than any other cigarette. The advertisement usually showed a smiling physician in a white coat, sometimes holding a cigarette between his fingers, sometimes standing beside a patient or reviewing medical notes. The image was calm, professional, reassuring, and the slogan underneath delivered the final message. If doctors themselves preferred Camels, then this cigarette must be trustworthy. To the average reader flipping through a magazine in the late 1940s, the claim felt authoritative. It sounded like it came from research. It suggested data, surveys, scientific credibility. But the truth behind that slogan was far more complicated. The tobacco company J. Reynolds claimed that the statement was based on a nationwide survey of physicians. According to their advertisements, doctors had been asked which cigarette they personally smoked, and Camel supposedly came out on top. That explanation sounded reasonable, but the details of how the survey was conducted were rarely explained. How many doctors were surveyed? How were they selected? What questions were actually asked? The advertisements never said, and that lack of clarity was not accidental. The surveys were typically conducted through promotional events where doctors were offered free cigarettes to sample. Representatives from tobacco companies would distribute packs of different brands to physicians and later ask which one they preferred. Not which cigarette they believed was safest, not which cigarette they recommended for patients, simply which one they happened to smoke. The distinction was enormous, yet in the advertisement, that subtle difference disappeared completely. The survey about personal preference was transformed into a statement that sounded almost like medical approval. And once the campaign began, it spread everywhere. Magazines, newspapers, street posters, medical publications. The image of the smoking doctor became one of the most recognizable figures in American advertising. There were even variations of the campaign that suggested doctors recommended smoking to soothe throat irritation caused by other cigarette brands. In some ads, physicians were shown saying things like, "Camels are so mild that I recommend them to my patients." Statements like this gave the impression that cigarettes had passed some kind of medical evaluation. But in reality, the campaign relied on something much simpler. Trust. People trusted doctors, and the tobacco industry turned that trust into one of the most powerful marketing tools of the 20th century. While cigarette advertisements were showing doctors smiling beside brand logos, something very different was happening quietly inside hospitals and research laboratories. Doctors across the United States had started noticing a troubling pattern. Lung cancer, once considered a relatively rare disease, seemed to be appearing more frequently. Medical records from large hospitals began showing a steady increase in cases during the first half of the 20th century. At first, the rise puzzled researchers. Cancer itself was not a new disease, but lung cancer in particular had historically been uncommon. For decades, it had been treated as a medical rarity. Then, sometime in the 1930s and 1942, physicians began asking an uncomfortable question. Why were so many of these patients smokers? Early studies did not immediately prove that cigarettes caused cancer. Science rarely moves that quickly, but researchers were starting to see correlations that were difficult to ignore. Patients with lung cancer were overwhelmingly long-term smokers. As more data appeared, the connection grew stronger. By the late 1940s, several major studies were already suggesting that cigarette smoking might be a significant factor in lung disease and cancer. Researchers in both the United States and the United Kingdom began publishing reports examining the relationship between smoking habits and rising cancer rates. These were not fringe scientists. They were respected medical researchers working in universities and hospitals, and their findings were starting to attract attention. Inside the medical community, discussions about smoking were becoming more serious. Some doctors began quietly advising patients to reduce their cigarette consumption. Others were less certain. The evidence was still emerging, and public health research was only beginning to understand the scale of the problem. But one thing was becoming increasingly clear: smoking was no longer being viewed as completely harmless. Yet outside research circles, the public saw a completely different picture. Magazines continued publishing full-page cigarette advertisements. Posters showed confident doctors holding cigarette packs. Radio programs were sponsored by tobacco companies. The cultural image of smoking remained calm, sophisticated, even glamorous. And for millions of Americans, cigarettes had become deeply embedded in daily life. People smoked while driving, while working, while relaxing at home, in restaurants, airplanes, offices, hospitals, even inside doctors' offices. Which meant that when the first scientific warnings began appearing, they collided with something incredibly powerful: a social habit that had already become normal, and industries that had enormous financial incentives to keep it that way. Because by the early 1950s, the tobacco business in the United States was worth billions of dollars. And if the growing medical concerns were confirmed, the consequences for that industry would be enormous. So the companies faced a difficult question. What happens when the science begins to challenge the product? For the tobacco industry, the answer would shape one of the most controversial chapters in corporate history. By the early 1950s, the tobacco industry faced a problem it could no longer ignore. The scientific warnings were becoming louder. Research linking cigarette smoking to lung cancer was appearing in respected medical journals. Epidemiological studies were beginning to show strong statistical connections between smoking habits and rising cancer rates. The pattern was becoming difficult to dismiss. But for the tobacco companies, accepting those findings would have meant something catastrophic. It would mean admitting that their most profitable product might be dangerous. And the cigarette industry in the United States was enormous. Tobacco companies were earning billions of dollars every year. Millions of Americans smoked daily. Cigarettes were woven into the culture of work, leisure, and social life. If public trust collapsed, the consequences could reshape the entire industry. So the companies made a strategic decision. Instead of proving cigarettes were safe, they would focus on something much easier: creating doubt. In 1954, major tobacco companies published a full-page advertisement in hundreds of newspapers across the United States. The document was titled, "A Frank Statement to Cigarette Smokers." At first glance, the statement sounded responsible and reassuring. The companies acknowledged that some studies had raised concerns about smoking and health. They promised to support scientific research and claimed they cared deeply about public well-being. But hidden inside the carefully crafted language was a powerful strategy. The goal was not to resolve the scientific debate. The goal was to prolong it. If the public believed the science was uncertain, people would continue smoking. If doubt existed, the industry could continue operating. And so tobacco companies began funding research programs designed not necessarily to discover the truth, but to challenge existing studies. Scientists who questioned the link between smoking and cancer received funding. Studies emphasizing uncertainty received attention. The debate became louder, more complicated, and more confusing for the public. For years, the strategy worked. Smoking remained socially acceptable. Advertisements continued. And millions of people trusted that if cigarettes were truly dangerous, someone would stop them. But history eventually caught up with the industry. By the 1960s, the evidence linking smoking to lung cancer and other diseases had become overwhelming. Governments began issuing warnings. Public health campaigns started spreading awareness. The image of the smoking doctor slowly disappeared, and what remained behind was a troubling realization. For decades, one of the most trusted symbols in society, the doctor had been used to sell a product that would later be linked to millions of deaths worldwide. It is a reminder of something uncomfortable. Trust can be powerful, but it can also be exploited. And sometimes, the most convincing messages are not the ones supported by truth, but the ones designed to look like it. If this story made you see history a little differently, consider subscribing to the channel, because many of the products and ideas we still trust today have stories hidden behind them. Stories written in documents, reports, and decisions that shape the modern world. And sometimes those stories begin with something as simple as a cigarette and a doctor's white coat.